So, all right, so we're recording. So, like I said, this is based off of, or kind of the idea for this program was initiated by the book, the One Maryland One book that we have this year, What's Mine and Yours. Just a brief summary of the book for anyone that hasn't read it. It is a multi-generational saga featuring two North Carolina families in the 1990s. They collide in ways that neither is prepared for when Black students from the east side of the county are integrated into the predominantly white schools on the west side. Readers will follow these families over decades as they break apart and come back together. One of the three timelines in the book focuses on Lacey May and her daughters. Lacey May's husband, Robbie, is in prison. She is unable to find work and eventually agrees to move in with a man who her but she does not reciprocate the feelings, and he does have a lot of shortcomings. So despite these shortcomings, Lacey May sees this marriage as the only way that she can support herself and her girls. And from this storyline kind of came the purpose of this program. So tonight what we're going to do is hear from experts from the county on parent imprisonment, how it impacts children, as well as other adverse childhood experiences that impact children in our community. For our panelists tonight, we have Stephanie Freeman, Rebecca Bowles. Unfortunately, Mr. Henry could not make it tonight, and then we'll also have Jill Hutchinson. They'll each be speaking from a different perspective on how they work with children and people in the community in regards to adverse childhood experiences. So my other speakers are probably going to touch on this tonight, but just to give you a quick overview of what an adverse childhood experience is. So these are potentially traumatic events that occur in childhood. So it can be, a child that experiences violence, abuse, or neglect in the home, that they witness some type of violence, whether it's in the home or in the community. Children who have a family member who attempt or die by suicide, and then also just growing up in a household where the children see substance abuse, where there's mental health problems, any instability due to parents being separated, and household members being in jail or prison. So right before we get to our first speaker, I do have this video. It's about 10 minutes called Echoes of Incarceration. It can be found on YouTube. And it was produced by a group of teenagers, can't remember which city it was, but it was in a large city, who have a parent who is incarcerated, or at one time their parent was incarcerated, and they speak from their experience on what that was like, what the situation was like for them. So I'm going to play that for you guys, and then if we have any thoughts afterwards, any questions, anybody wants to point anything out in that, we can do that after the video, and then we'll move into our first speaker. For me, the big takeaway there is just the intricacies of all the ways that a child is impacted by a parent being in prison that you don't think about. There's big things on the surface that come to mind if you really think about it, but there's a lot of just little things. The fact of, the one girl said that the children get treated like prisoners. They aren't given any respect. They're deemed just as bad as, the parent or the person that's in prison. Does anybody have any other thoughts or takeaways that they wanted to share?
I found it interesting that one of the gentlemen in there had said that he was having issues with anger, and then as soon as mom came home, he knew how to control it. Just having her home and having that stability, I guess, of her not being gone anymore, really just like flipped the switch in him. I found that really interesting.
Yeah. So I'm going to go ahead and move to our next slide. And that brings us to Stephanie Freeman. And so she's going to talk to us more about adverse childhood experiences, or ACEs. and also their relation to incarceration. So Stephanie, if you just want to give us a brief introduction about yourself, and let me know when you need me to change the slide.
Absolutely, thank you. And hi, everybody. As Elizabeth said, I'm Stephanie Freeman, and I am the Child, Adolescent, and Young Adult Coordinator, or CAYA Coordinator for short, at the St. Mary's County Health Department and the local Behavioral Health Authority. So that's a little bit about me. You can go ahead and move on to the next slide, Elizabeth. Thank you. All right, so Elizabeth had covered this already, but adverse childhood experiences, as she said, can be different types of abuse, neglect, and family dysfunction. But can also be things like fights at school, or car accidents, or natural disasters, pandemic. So all of those things can affect a young person's life before they turn 18, and that could be things either traumatic or stressful. And it doesn't matter how we consider them. Again, it's how the child interprets that information. So you can go ahead and move on. All right. So I'm going to be talking about an ACE score throughout the next couple slides. And an ACE score is determined by using this questionnaire that's in front of you. So this questionnaire is focused on 10 different adverse childhood experiences. This isn't a full encompassed list. It also doesn't say like how long that these traumatic experiences is going on. So there are some issues with it, but when I am talking about the ACE score, this is what I'm going to be referencing. So just for an example, let's say that I'm going through this questionnaire and I say yes to question 1. That means I get 1 point for that particular question. And then if I go to 2 and I say yes to that, then that means that I then have an ACE score of 2, and so on and so forth as you move through this questionnaire. And do we have any questions about that before I move on? Okay, so go ahead, Elizabeth. All right, so right here, we are going to be talking about the 1990s ACE study that was conducted by the CDC and Kaiser Permanente. I'm sure many of you are familiar with Dr. Rob Anda and Dr. Vincent Folletti, who are the actual investigators of this study that took place. So this study had about 17,000 people in it. It did take place in California, and most of the participants were white and well-educated and had access to medical care as well. So we were talking about pretty much average middle class of this conversation when we're looking at these numbers right here. And in that study, they had found that ACEs are also linked to developing chronic diseases and experiencing social issues when you enter adulthood. So as we see right here on the left, I'm moving my cursor, you can't see that, but the graph on the left, we are comparing men and women and their depression rates based on the number of ACEs that they have. So in this left set of bars, you see that it's an ACE score of 0, men are blue and women are green. And we're gonna say maybe about 10, 11% of men reported that they had depression without any ACEs. So on that questionnaire, they reported that they didn't experience any of those before turning 18. And then women, we see they're a little bit higher, maybe about, let's say 18, 19% or so. And then on that right side of the graph, you see that that's an ACE score of 4 or more. So people who took that questionnaire and answered yes to 4 or more of those questions. So it could be 4, 5, 6, 7, all the way up to 10. And we see here that the numbers did jump, right? So we've got men that reported having depression by about 38, 39%. And then we see about 60% of women reported experiencing depression later in adulthood, after experiencing adverse childhood experiences or traumatic events before the age of 18. So we can see that ACEs and depression can be very highly correlated. We're seeing a big gap there from 0 to 4. And then on this right set of this right graph that I have over here, we are comparing ACEs, health outcomes, and social outcomes. So it did kind of change a little bit. So the blue is going to be an ACE score of 0 across all of the graphs that you see there. And then the green is going to be an ACE score of 4 or more. So we see that individuals who have an ACE score of 0, they're about 3% of them have reported being an alcoholic. And then those individuals who had an ACE score of 4 or more, about 15, 16% had reported being an alcoholic. So that even just comes down to even some health issues, because you can obviously start to have some health consequences against your liver and just your overall health from drinking too much alcohol. So we see that traumatic experiences can increase your risk of being an alcoholic. And then in the middle there, we see marrying an alcoholic. So this is where the social outcomes kind of come into play. So we're seeing that those with an ACE score of 0, about 12% of them had married an alcoholic, while we're seeing 33% of individuals with an ACE score of 4 or more did marry an alcoholic. So pretty staggering numbers right there. You're seeing a big jump from ACEs being non-existent in somebody's life, and then when they're really prominent in somebody's life. And then the end graph there, we have developing COPD into adulthood. So again, blue is 0, 4 or more is green, and that number about doubles. So about 4% of people who didn't experience any ACEs developed COPD, while about 9% of people that experienced 4 or more ACEs did develop COPD. So we are seeing a relationship between the number of ACEs you experience and chronic health diseases and health outcomes, and even some social outcomes that can occur into adulthood. Next slide, please. And then we were also talking about incarceration and even going further more into kind of what can happen or could happen when you experience ACEs as a child. Another study that was actually conducted in the UK and Welsh, in August of 2017, an individual with an ACE score of 4 or more is 2 times more likely to smoke, 2.3 times more likely to develop cancer, 7 times more likely to misuse alcohol, 10 times more likely to inject illicit drugs, and 12 times more likely to attempt suicide. And that very last line on there, they're 20 times more likely to have been incarcerated at some point in their lives. So ACEs are having a dramatic effect on the incarceration rates, even in the UK. So we can't say, obviously, this is what's happening in the US, but if this is happening in the UK and the same questionnaire is being used across all platforms, then we can make a safe assumption that there is a relationship between ACEs and also between incarceration and your likelihood to be incarcerated if you experience 4 or more ACEs. You can go ahead and move on to the next slide. And then just going more into ACEs and the prison population, the Compassion Prison Project is a fantastic project. I highly encourage you to look into it. It is a support group that is pretty much trying to help and make policy changes that for the incarcerated population and their families, just like how we had talked about or seen in the video previously, about making policy changes and giving advice to lawmakers. This project is already working on that. So that's one place that you could look into. But as we see here in these pie graphs here, the information on the left is from the CDC, and about 64% of the US population has experienced at least one adverse childhood experience. So whether that be abuse, physically, sexually, or even parental separation, the family dysfunction, all of those things that we had seen at the beginning of this presentation. And then if you look at the right paragraph, 98% of the prison population has had at least one adverse childhood experience. 98%. So we are seeing, again, a relationship between the number of ACEs that you experience and your likelihood to be incarcerated. And again, these could just be even your parent being incarcerated, or the divorce and separation, or any sort of abuse or neglect and stuff like that. And again, 20 times more likely to be incarcerated at some point in your life with 4 or more ACEs. So, and we see here that 78.1% of individuals that are in prison have experienced at least 4 or more ACEs. So go ahead and move on to the next slide, please. All right. So now we're going to look at how does that affect us? Why are we even talking about that? We see it in the whole population, but now let's talk about what's going on in Maryland and St. Mary's County, because that's where we are. So in St. Mary's County, about 64.3% of the entire population, or excuse me, the adult population has experienced at least one adverse childhood experience. And that was the most recent data we have is from 2018. So from 2018, at least 64% of people have experienced an adverse childhood experience. But this information, again, is from 2018. So in Maryland, we've got the blue, St. Mary's County, we've got the green, and we are seeing that Maryland and St. Mary's are pretty closely related in the number of ACEs that have been experienced. So from 0 ACEs, the Maryland population about 38%, St. Mary's County population that experienced no adverse childhood experiences is about 35%, and then 1 to 2 ACEs, we've got, again, about 38-39% for Maryland, and then a little bit lower in St. Mary's County, and then 3 or more ACEs for Maryland, about 22-23%, and then 3 or more ACEs in St. Mary's County is actually higher than the Maryland data, as we're seeing here, about 28% or so. So that's why we're talking about ACEs. So as we can see, 3 or more individuals have experienced, we're seeing about 28% of individuals in St. Mary's County have experienced 3 or more ACEs. And as we saw on the last slide, about, 78% of individuals in prison had experienced 4 or more ACEs. So what are we going to do about it, right? Next slide, please. So how can we prevent and mitigate the impacts of ACEs? You could click the slide for me, Elizabeth, please. We can build resilience. So resilience is essentially your ability to bounce back. So it's that ability to overcome any stressful event that you had gone through. Because we can't stop a pandemic from happening. We can't stop every single parent from abusing their child, unfortunately. These things are just going to happen. So what do we do about it? So we can build resilience. And the next slide, Elizabeth. And one way that we can actually build resilience is providing education to the community. So what we've done in St. Mary's County is we actually did a commercial. If you could go ahead and go to that commercial, Elizabeth. You are muted, I'm so sorry.
All right, let me switch my share screens again, or actually, you know what, hold on. Drag this over here. Can you see the YouTube screen is up? Okay.
My life wasn't easy growing up. My parents got divorced. Out for help and learned more about adverse childhood experiences. Or people have experienced divorce, violence, neglect, poverty, or ACEs, which may impact their physical.
Back over there.
Thank you.
Okay.
So we had the commercial going on during March Madness. So this was early spring, I guess, late fall, early spring when we had this commercial going. And as you can see there, we had quite a few views. And this is just a predictive number that they have reported to us. I don't know what the most recent number is, but we also had it going on during the Super Bowl Sunday. So a lot of people had seen this advertisement, and we, again, started with that education around the community. Next slide, please. And the most recent thing that I think we have done as far as providing education is we launched a data dashboard in January of 2022. And this is the same information that was used in the previous slides that I had discussed, the 2018 YRBS data, to pretty much show what ACEs are being reported. So this dashboard goes through household substance use, sexual abuse, household mental illness, so on and so forth. And they essentially use that ACEs questionnaire that was seen in the beginning of the presentation. And now all of this information is posted on our website. So this is free information for anyone to look at, have access to, use it for anything that they need to. So it's a wonderful resource that we were able to put out there. And once we have more data, we'll be able to compare the 2015 data, the 2018 data, and I think the most recent would be 2020. Yeah, I think I got that right. The next slide, please. All right. And then we had also done 2 billboards regarding ACEs, again, to provide that education to the community. We had one posted at the 235 and Route 5 right at that Mechanicsville Wawa. High traffic area, had several people pass that every single day. And I want to say it was up for about 8 weeks. And then the second one was down at the southern end of the county, not as far south it needs to be, but there's less billboards down there. And we did it in California at Airport View Drive, which is right next to the Bruiser's Ice Cream and Tractor Supply and stuff like that. So again, high traffic area, and I want to say that one was up for about maybe 12 weeks or so. And it even had, it's called geofencing, where if someone was on their phone when they were driving, say it's a passenger, that it would actually pop up on our website would pop up on their phones where they could link to it and see more information about ACEs and get help and things like that if they needed to. So again, that 64%, 2 in 3 St. Mary's County residents have experienced at least one adverse childhood experience. So very staggering numbers there that we're seeing in the county. Next slide, please. Right, and then another way to build resilience is being able to come together. And one way that the St. Mary's County Health Department is doing that is we have launched a Mentoring Connections program. This program has been going on for about a year now. We are still steady growing, but this is exactly what it sounds like. It's a Mentoring Connections program. So I get a referral from an individual in the community, whether that's a parent or Department of Juvenile Services, the school system, Center for Children, the list goes on. But I do an intake interview with that child where we talk about what ACEs are and pretty much give them that community education on it. And then we also talk about resilience. So again, that ability to bounce back. And then I get them linked with a youth mentor. And that's a youth mentor somewhere in the county. So that's, as we see here, we've got Willow's Rec Center, the Cove, Basketball for Life, Gals Lead, Knowledge Boxing, Tri-County Youth Services Bureau. There's a few more that were recently added to the list. There's like Divine by Design and Gift to Uplift with Mr. James Henry that unfortunately wasn't able to make it today. And there's also now a Boys and Girls Club that I opened up in Lexington Park. So we've got some programs out there. We are slowly building. When this program first started, we about had maybe 4 programs, and now we're over 10. So big things happening. And this flyer says that we accept youth ages 12 to 18, which is no longer correct. We actually take all the way down to 7 to 17. So unfortunately, most programs, once they turn 18, they age out, but we do have a big gap now all the way down to elementary school. So if anyone's interested in that, we do have a website. Oh, and that's okay. And you can send that information to me, but we'll get to that. So now you can move on. Thank you.
I'm very happy.
And then another way that we can come together is we can volunteer. So we have the Healthy St. Mary's Partnership, which is the Behavioral Health, or BHAT, the Violence, Injury, and Trauma Action Team, the Chronic Disease Action Team, and the Environmental Health Action Team meetings that occur monthly. I know several of you have been on those before, so please come out to those meetings and come support us and get involved in the community. You can also become a mentor. We're always looking for more mentors, but you can also provide education and meet people in the community through food banks, soup kitchens, clothing drives, community garden, and so on and so forth. Also attending community events to gather more information and make more connections, like the one we're at right now. We also hold some Understanding ACEs training, so if you like to listen to me talk for about 2 hours, please come to those as well. We also have community town halls. You can go to the commissioner meetings and vouch and say that we need more people to support the youth, just like the YMCA, which obviously has been a big issue in this county as we're getting it approved and going through all of that process. So going out and having a voice and speaking up for the youth in the community, and also just getting to know your community and getting to know your neighborhood to be able to make those connections and be closer together. Because unfortunately in this county, we're all kind of spread out. We don't have a whole bunch of community I guess, parks for all of us to come together. I know we have like the county parks and stuff like that, but they're not really big gatherings where people feel comfortable to go to. So just get to know your neighborhood, know your neighbor, know who your kids are hanging out with, teachers, and so on and so forth. So there's obviously more that can go into this, but these are just a couple of ways that you can get involved and give back to the community. And that's it. So there's my contact information. I am unfortunately never in the office, so probably don't call that phone number. But if you need anything, that is my cell phone number. You can call it, text it, and there's my email as well if anyone wants to further the discussion. So thank you.
Thank you, Stephanie. That was really informative. So I'm going to kick off with a couple of questions. If anyone else has questions, feel free to pop them in the chat or just turn on your mic and ask Stephanie any question. So my first question is about the studies. So so the statewide study and the county, are they two separate? Like, where is the information coming from for like this 2018 and then this, what the newest one is going to come?
Coming from the BRFS survey, which is sent out through the school system.
Okay.
And yeah, so through the school system, they collect all of the data with their youth. And Jill, do you know anything about this survey too? Maybe through ECAC?
I just know that it's done in the schools. It's anonymous. It's done by, I believe, just the high schoolers. I don't think it's the middle schoolers. And it gives us a lot of information about the stuff that they're up to or experiencing that the grown-ups in their lives may or may not know about. And it's really important, valuable information for us to know kind of what's up in the lives of our young people and what they need from the adults in our community. And I really encourage everyone to take a look at that, because there will be some things in the results that may surprise you.
Yeah, and there was recently a pandemic one that was done as well. And that one had some pretty staggering information. And I had used the acronym earlier, I apologize. BRFS stands for Behavioral Risk Factor Surveillance System. So that's where that information came from. And it is produced by the CDC. It's just trickled down through the high schools and the school system.
Okay. So my other question was about on your data sheet about ACEs compared between the state and the county. The one where St. Mary's County had more was the 3 or more ACEs. We were higher than the state. So do we know what the difference is there? Like, why is there the disparity? On the other two, we have, it's higher amongst the state to have, the ACEs, but then when we get to that 3, like, what's happening?
It's a very good question. I wish I had the breakdown of which ACEs were reported yes or no, and then we could kind of look at environmental factors and seeing what those differences are. But unfortunately, off the top of my head, I don't know what those differences are. But very good question. That's something I should look into.
Thank you. So those were my 2 questions. Does anybody else have any questions for Stephanie before we move on? Okay, so now we're going to move on to Rebecca. So Rebecca Bowles is a peer recovery specialist. She's with the LEAD program with the St. Mary's County Health Department. The LEAD program is the Law Assisted Diversion program, and they work in collaboration with the St. Mary's County Sheriff's Department. Rebecca is in long-term recovery. She's a mother of 2, a wife, and a college student. She's busy. She enjoys working with the community and meeting people where they are in their lives. So I'm going to turn it over to Rebecca to talk to us about this program.
Good evening, everybody. As Elizabeth said, yes, I'm in long-term recovery. So I have a where I meet with the clients exactly where they are. So I'm able to kind of sit down with them and kind of be right on their level and be able to work with the community in that sense. I also help, I do work in collaboration with the Sheriff's Department. However, I work extremely closely with the harm reduction program that we have with the St. Mary's County Health Department as well. I actually sit down at our health hub, which is in Lexington Park, which is brand new. And the harm reduction office is basically a program that meets our participants right where they are, and we provide clean and safe products, or not products, syringes, any type of any type of supplies they may need for any type of services that they may be using to stay safe and healthy within the community, or whatever they're using at that particular time. But we'll go into my program, and LEAD is very new to St. Mary's County. It was actually started in Seattle, Washington. LEAD is a Law Assisted Diversion program. However, it just recently, within the last couple years, has been switched over to Let Everyone Advance with Dignity. It is a harm reduction based public safety program designed to assist people before they enter the criminal justice system. So basically, this program is where the officer is going to be able to refer a person to us prior to them being incarcerated. So as it states, LEAD is known to be a tool for officers, allowing them to intervene and assist individuals in need. LEAD, myself, I am the peer recovery specialist, which I also am the care coordinator at this time. I work with the participants to connect them with a wide range of support services. So that can include substance use disorder treatment, housing, food if they need food. That can be financial assistance, insurance, anything that they may need at that moment in time. That's what we're going to do. We have a very lengthy process that we go through with each individual person, where we actually set goals with each person. And we will, depending on the person, will be how often we will meet with them, and how often their goals need to be met. Next slide. So here's the goals that we have. Basically, these are the things that we do with them as we sit down with them and go over the process with them. And, you know, we try to work through these as much as possible. And we try to keep them moving through the process and, you know, working through their goals as quickly as possible. Not as quickly as possible, but, you know, as well as we can. Next slide. And then this is my primary goal. So I maintain a caseload. Again, I provide that linkage to care, to community resources. I support to assist participants in maintaining recovery and prevent entry into the criminal justice system. Now, they can, even while they're enrolled in my program, still enter the criminal justice system. However, I can support them on another level once if they end up in the criminal justice system. I maintain a collaborative relationship with the community partners and support service agencies. And then I attend a specific meeting. Right now, it's tentatively scheduled to be monthly to discuss the status of each individual in my program. And that's when it's necessary to get input and assistance from operational partners in regards to particular participants. Now, our operational partners are always going to be one of the sheriff's officers. Sometimes the state's attorney will hopefully be attending those meetings as well as my lead coordinator as well. I'm going to be maintaining documentation. We also collect a lot of data that goes to the state, so they can keep their records as well. And then I encourage clients to participate in other self-help or peer recovery activities. So the biggest thing too with this program is they do not have to be in recovery to work this program or for me to work with them. They can still be in active use, and I will still work with them. And last but not least, I will evaluate the participant's satisfaction with this program towards recovery and wellness goals. As I stated, that's one of the biggest things, is setting goals with them. And next slide. And that is it. Does anyone have any questions? I know that was a lot. I'm sorry.
That's okay. That was great. Thank you, Rebecca. I was doing a couple things at once when you first started, so I might have missed it. Is this just for people that are 18 and older, or do you work with any youth?
So right now, this program is for 18 and older. We have not gotten, in most jurisdictions, that's what it is. It's for 18 and older. They have not started a program for anyone younger than 18 that I'm aware of. And that's most states as well, including Seattle, where it was started.
Okay. All right, so if you guys think of any questions, just pop them in the chat or in the Q&A box. We'll go ahead and keep moving. So now we're going to move on to Jill Hutchison. She is our Youth Services Coordinator here at the St. Mary's County Public Library, and she's going to talk about a program that she has worked on in the past, and she can tell us if they're picking back up again or not, because the pandemic, as with most things, you know, kind of slowed things down here. So I'm going to let her take over and tell you about the school program.
Great, thank you, Elizabeth. So as Elizabeth said, I'm the Youth Services Coordinator for St. Mary's County Library, and I'm also currently the chair of the Early Childhood Advisory Council, which was the original sponsor of this program. Next slide, please. So I'm going to start with a quiz. How many people in Maryland are incarcerated or under criminal justice supervision? So this would be people that are currently locked up or on home detention, parole, or probation. You put type more or less in the chat with your educated guess. Do you think it is less than 100,000 people or more than 100,000 people? Come on, somebody guess.
Somebody guess.
Panelists can guess too.
I can't guess. I've seen the answers.
Okay, Rebecca thinks it's more. All right, well, I'll end the suspense. Next slide, please.
Okay. All right. Oops.
It is more. Now, this data, all the data that I'm going to be sharing here is from 2018. Most of my sources haven't been updated during the pandemic, so about 117,000 people in Maryland are either currently incarcerated or under another form of criminal justice supervision. About 36,000 as of 2018 were actually behind bars at that moment, and the rest were on parole, probation, or home detention. Next slide. So how many children in the state of Maryland do you think have a parent who is either incarcerated or under correctional supervision? Do you think it's less than 50,000 or more than 50,000? Okay, Stephanie thinks it's more. Let's see. All right, next slide. 90,000. This was in 2018. It's probably similar now. Yeah, so that's a lot. Now, not all of those parents are behind bars, but they're still involved with the criminal justice system and not fully free, and that has strong effects on their children. Next slide.
And I just want to add, Kelsey said in the Q&A that Maryland leads the 1,000. Yeah. I lost my place.
Maryland leads the nation with more than 50K. Yeah. Yes, it's a very sad statistic. So what percent of incarcerated adults, now this is national data, we were not able to find this data broken down for the state of Maryland. So nationally, as of 2018, what percent of incarcerated adults have one or more minor children? So they're currently in jail and they're the parent of at least one child under 18. Do you think it's less than 50% or more than 50%?
Kelsey says more.
All right, next slide. Let's find out. It's between 50 and 75%. And the reason there's such a wide range there is that the Justice Department does not keep statistics. So these numbers are gleaned from nonprofit organizations that work with the incarcerated population, and they've done sampling studies, but they don't have, full access to all prisoner records from all correctional institutions. So these are estimates. And also, go back a second, Elizabeth.
Oh, I'm sorry.
Yep. Also, of incarcerated adults who are parents, between 44 and 55% of fathers had at least one minor child who was living with them before they were incarcerated, and between 64 and 84% of incarcerated mothers were removed from a home with a child. And the really sad statistic is 59% of fathers and 58% of mothers who were incarcerated had 0 personal visits from any of their children during the term of their sentence. So that is pretty much complete and total separation from parents. And 62% of parents who are in state prisons nationwide and 84% of parents in the federal prison system are held at facilities more than 100 miles away from their residence. So that's a huge barrier to that visitation and to maintaining the connection with their families. All right, next slide, please. And this is just to show that it's partially a racial justice issue as well, because there are big racial and ethnic disparities in who's incarcerated. So this is Maryland. So the dot on the left is what percent of our state's population belongs to each of these racial or ethnic groups, and then the percent of the prison and jail population of that group. So you see, for example, Black Marylanders make up 29% of our population statewide, but they represent 68% of our incarcerated population. So that's an issue. Next slide. So Stephanie already talked about some of the overall impacts on children from ACEs in general, specifically from having a parent incarcerated. Children experience trauma, especially if they're present when their parent is arrested, or come home to. One of the young people in the video that we started with talked about coming home after their parent had been arrested and finding that the house had been ransacked by the arresting officers. So that's traumatic, and they're often also removed from the home that they were living in and sent to live somewhere else. So that's also a form of trauma. They experience grief, especially young children experience separation in a way similar to the death of a parent or other important adult. So they go through the stages of grief. As I said, often they have to change where they're living and go to new caregivers. They might go into foster care, or more commonly, they'll go into kinship care. So they're taken in by extended family. Incarceration of somebody who was a wage earner for the family can lead to poverty and family instability. And again, as those young people in the first video talked about, they experience stigma and social isolation. A lot of families will tell their children to conceal the fact that their parent is in prison. They'll say they'll tell the other people, friends and family, the school, that the parent is away or is in school or is sick, and so that becomes like a shameful secret to those children. Because of all this disruption and change of caregivers and the isolation, these children are at increased risk of abuse, with all of the adverse effects that come from that. And a lot of children who have a parent incarcerated have poor academic outcomes. These are very depressing facts, but they are true. So next slide.
Yep.
So what makes a difference? Okay, click again. So some of the protective factors that can help build the resilience Stephanie was talking about, particularly with children whose parents are incarcerated, more so than all types of ACEs, is maintaining strong relationships, both with the absent parent and with other safe adults in their life, having opportunities to bond, again, both with the absent parent whenever possible and with the current caregivers, helping children build their confidence, and providing parenting support to both the incarcerated parent and the person, whether it's the other parent or another family caregiver, about what to expect, how to help their children through this traumatic experience, how to create routines and rituals to help the child feel normal and stay connected, and also talking openly about what's happening and the feelings and problems that they're experiencing. And so, to that end, this is a very small program that was really just in its infancy when we had to go on hiatus for the pandemic, and we do hope to restart and expand it in the near future. So the Early Childhood Advisory Council had a small grant, and one of the ways that we used it was to buy the materials to start this program. And it's very simply named Family Reading Program at St. Mary's County Detention Center. Next slide. So who's involved? St. Mary's County Library, the St. Mary's County Detention Center, the video visitation vendor that the St. Mary's County Detention Center uses, it's a company called IC Solutions, and they provide phone service and video service to the detention center inmates and their friends and family on the outside. And the St. Mary's County Early Childhood Advisory Council provided the funds. Next slide. So what do? It's pretty simple. We provide workshops on family literacy to inmates who are parents or have a parental role to a child that they're separated from while they're in the detention center. And then we provide 2 copies of sets of books, 1 copy for the inmate to keep with them, and 1 copy gets sent to the child via their caregiver on the outside. And then after the workshops and when the books have been delivered, the families can participate in phone and video visits, and they can read together because they each have a copy of the book. So in the weeks leading up to one of our workshops, the corrections officers will go through the housing units and let the inmates know that this is coming up, what's involved. In order to participate, they have to be able to meet 3 criteria. They have to be a parent or have a parental role with a child on the outside. They have to be allowed to be in contact with that child. Some parents are incarcerated for reasons related to abuse or neglect, and they may not be able to be in contact with their child at this time. And 3, they have to have at least 1 form of contact information for the current caregiver of their child. Otherwise, we won't be able to get the books to them, so they wouldn't be able to participate. So if they meet those 3 criteria, they fill out a very simple form with their name, their housing unit, and how many children they have and the ages of the children. And I use that information to know how many books to bring and what kinds of books. So if the majority of the children of the parents that are going to be in the next workshop are very young, I'll bring mostly picture books. If they're a mix of ages, I might bring chapter books for the older kids. And the books have to be soft cover. That is a detention center rule. They cannot have ring binding, spiral binding, or hardcover. So that does limit what books we can pick. I'm usually buying them from the Scholastic catalog because they have a lot of wonderful books that are available in inexpensive paperbacks. And as I say, I'll bring even numbers of all the books because each parent is going to go through and pick out up to 10 books per child. And some of them have multiple children, so they're picking out a pretty big stack of books. And they'll take 2 of each into their stack as they're making their selections. And then at the end of the workshop, they're all going to give me half. And I keep track of, I have their little forms that they filled out at the beginning. I bring those in with me, and I stack the selections from each parent together with their form, so I know what books are going to whose children when I get back to the library and make up the packages. And an interesting thing that happens is we use pencils, no pens, and I bring in the pencils, and they all have to be counted on the way in, because the participants are going to be like writing, taking notes and adding information to their little forms that they're going to give back to me. And then on the way out, all the pencils have to be counted again to make sure that none stayed in the detention center. So it's little things like that that kind of let you know how serious this can be. So they pick out all their books first, and then we sit around. The library inside the detention center is basically just kind of a biggish conference room with a big table in the middle and some bookshelves around the walls. And there are no children's materials in that library. It's primarily self-help law books, lots of Bibles and some paperback romance and adventure books. And that's about it. So when they come in and see these bright, fun children's books on the table, they get really excited. And the first time I ever did it, my plan was to do the workshop first and then have them pick out the books at the end after receiving all the information about how they're going to use the books with their children. That did not work. They were so excited. I couldn't make them wait. So they all picked, but some of them did swap out their selections afterwards. So then they've got their stacks of books in front of them, and we talk about, what ages their children are, and then we talk about ways to use the books with our children. We talk about using books to have conversations. So you don't always have to just read straight through, but you can stop for a picture book. You can talk about what's on the page. What do you see here? What do you think they're doing? Asking questions. And even for older children that you're reading chapter books, we talk about different ways to share them, like taking turns reading, or reading, like one reader reads one character and one reader reads another character, different ways like that. But we spend a lot of time talking about ways to use books to have conversations with their children. And that's for a number of reasons. One is mainly that it's really important for children and parents when they're separated to talk and communicate and strengthen their connection. But when parents are incarcerated and they're separated from their children, they're not part of their kids' everyday life anymore. They don't know what's going on. They're not talking about tying shoes. They're not talking about what to have for breakfast. So often when they do get on the phone or on a video visit with their child, they run out of things to talk about. And also, as any of you who have ever tried to talk about feelings with a child or a teenager before, asking them, how are you feeling? What feelings are you having? Doesn't always go so well, but we talk about ways to use the social emotional aspects of the books, which, by the way, are sneakily selected by me to involve themes that lend themselves to these, to talk about feelings. So, for example, one of the books there is, let's see, How Do Dinosaurs Say I'm Mad? So if they're reading that with a young child and they are talking about what the dinosaurs do when they're mad, and is that good, and what could they do instead, that can help them, talk with their children about their own angry feelings and how they can manage them. And same with chapter books. If somebody in a chapter book is getting into trouble or getting in a fight, they can ask their kids, ooh, I'm not sure that's a good idea. What do you think they should do? And kind of get at things like that. And so we talk a lot about that. And sometimes we also diverge and talk about, their own experiences with reading and books. And I always try to include some older titles that the parents themselves might recognize and be excited to share with their kids. So that's the workshop. It lasts about an hour. And because of detention center rules, we have to segregate by gender. So we'll have, the ladies and then the guys. I will say that even though the majority of inmates in our detention center are men, the majority of who signs up for this workshop are women. And there's probably a number of reasons for that. But so if inmates of both genders have signed up, we'll have 2 workshops back to back. And then I take the pile of books and the contact information for the children's caregivers on the outside back to the library with me, and I put them in the mail. And I'm always careful to address them to the caregiver and not the child, and it doesn't show on the outside of the package what it is. And there's a letter in there that explains what it is and where the books came from, and it is up to that caregiver whether they tell the children where the books came from and engage in the program with the parent back in the detention center. So then next, they have, hopefully, if the children and the caregiver on the outside are up for participating, when they have their phone and video visits, they're able to do shared reading and use some of the techniques that we learned in the workshop to have conversations about books with their kiddos. And the purpose of this, as I said, is to help maintain those connections and strengthen those bonds. But it also gives those parents that are inside the detention center a couple of important messages. One is that they're not forgotten. Their community outside the detention center still cares about them. 2, that they're still their child's parent and they still have ways to contribute meaningfully to their child's life and well-being, even while they're apart. And 3, that their community hopes that they will succeed and be able to rejoin their families. when they've been released. Okay, I see a question in the chat. Do you see a lot of caregivers accepting the offer? Here's the thing. For a lot of privacy reasons, we don't get data back from the detention center on participation rates. We haven't really had a good way to track. So we send the books into the void, as it were, to those caregivers. Now, a lot of times the contact information that I'm given from the inmate is a phone number. They may not have the mailing address memorized. So when that's the case, I do speak to the caregiver on the phone. And the vast majority of them have said, oh, yes, that would be great. Send us the books. I'll make sure the child gets to communicate with their parent. So that's what we do. So next slide, please. Some of the obstacles to getting this going. And as I said, we were only in our beginning stages. I think we had made 4, maybe 5 visits to the detention center before these type of programs were shut down due to the pandemic. So the first obstacle was getting permission and engagement from the detention center. We knew that this was a type of program that had been successful elsewhere. A lot of other library systems, Anne Arundel County is a great example. They actually have a state correctional facility inside their county borders, and they have quite an extensive family literacy program there. But it built over time, and even they said that at the beginning it was very hard. We would, send emails and phone calls and talk to people from the detention center and the sheriff's office in person when we ran into them around the community. But it took a while to find the right person, the right staff person that was the person who had the authority to say yes and start making things happen. And once we did, we connected with a lady named Glenda Thompson, who was in charge of education and support for folks that were trying to be rehabilitated in the detention center, and she was able to get things rolling. Another challenge is communication with and within the detention center. For example, the staff that we work with to set all this up are 9 to 5 office staff, but we always go on the weekends because that's when the inmates are available for something like this. A lot of them have jobs and classes and required things that they're doing on the weekdays. So I'm going on a Saturday, and the staff that are working at the detention center on a Saturday or Sunday morning are different than the ones that I made the arrangements with and traded the permission slips with and so forth. So sometimes you show up to sign in and nobody knows you're coming and they're not ready. So that can be an issue. Funds for books, that's not a huge obstacle because our program is very small and these inexpensive little children's paperbacks are, only a few dollars each. In the future, if we were to scale the program and do more and have more sessions and more books, we would have to, come up with a more stable funding stream to buy those books. There are restrictions on books. Because this is a partnership program with the detention center, I am allowed to carry books with me into the jail. But St. Mary's County Detention Center, like a lot of other correctional facilities, has pretty stiff restrictions on books coming in otherwise. For example, you can't just mail an inmate a package with some books from the outside. They have to come from approved sources so that no contraband can be hidden in them. And again, they all have to be soft cover. There are restrictions on visitation. St. Mary's County Detention Center does not do any in-person visits, not even no contact visits. So when you see on TV that people are talking to their family member like through a glass wall, but in person, that doesn't happen here, and it hasn't for many years. All visitation is by video. And I hear from the inmates that I've worked with that the quality isn't that great a lot of the time. So family members can come to the detention center in person and sit in front of a video screen in one room, and their family member is inside in their housing unit sitting in front of a kiosk that also has a screen. So even though they're in the same building, they're not in the same room. And that's at least free, but they do have to come to the detention center to do that and sit in this special room. They can also put an app on their personal devices. These are the family members on the outside, and have a video visit session that way, but that costs money and it's not cheap. Just like phone calls from jail or prison are more expensive than phone calls on the outside, so are video visits. And every video visit session is a maximum of 25 minutes long. They have to be scheduled between 24 hours and 7 days in advance. They can't be scheduled on shorter notice, and they can't be scheduled any further out than 7 days. And then another challenge is reaching the caregivers of the children. So to participate, as I said, the parents have to have some kind of contact information, but sometimes it's out of date. Sometimes they didn't remember the phone number correctly. Sometimes I'll try many times to call the caregiver and they don't pick up and their voicemail box is full. So unfortunately, sometimes the parents get disappointed that their children never receive the books until they're released and can be reunited with them. The last obstacle is inmate participation. Nobody who's inside the detention center is having a good time. They're experiencing some of the worst days of their lives, and a lot of them have substance use disorders, and a lot of them have mental health disorders, and they're really struggling. So even though they may sign up during the weekdays when the corrections officers are talking up the program and inviting them to participate, when the day comes and the officers come into their housing unit to bring them to the detention center library, they just can't face it. They don't want to be reminded of how much they're missing their children, or they're having a bad mental health day and they just don't come. So there have been a couple of times when I've had, for example, like 4 male participants signed up, and I'm excited to actually have some fathers, and then 1 or none actually come to the session. And in talking with the corrections officers and with other folks that work with this population, they've just said, don't take it personally. It's not about you. It's about them, and about them, going through a really hard time. So next slide. So lessons learned, and this information is really more, I originally did this presentation for other libraries that were interested in doing this, but for anybody that wants to work with the incarcerated population, this will be helpful information. First, it's vital to find the right person to make that connection, and it might be a different person or a different job title in each institution. We hit a brick wall for months, almost a year, until we found just the right person that could get us an in, the person who had the power to say yes. Start small and simple. That's all we've done so far, is very simple, single event workshops, and then try to build on those successes. You have to know that the security and operational concerns of the institution are always going to reign supreme. Everything else is going to have to flex to that. Correction staff just do not have much authority to make exceptions to policies, to bend rules. They just can't. So you have to work within their requirements. I already mentioned that a lot of incarcerated adults are dealing with mental illness, so they may be struggling. It's important to have lots of choices of books because there's a lot of ages of children, and we try to have things that the parents will recognize and be excited to share with their kids. And then the last thing, and this would be for anybody working with families affected by incarceration, is that you have to be prepared for the emotional effects on yourself. This is a very sad situation for every family that's affected, and a lot of times working with these parents, their emotions really come to the surface. A lot of the time they're kind of keeping down how much they miss their children, how guilty they feel about the situation, how worried they are about their children's welfare while they're separated. But when we start thinking about our children and talking about our children and role playing how we're going to have conversations with our children around these books, that comes to the surface, and it can be hard to see. And so you just have to be prepared for that. All right, I think that's my whole presentation. I think I went longer than the 10 minutes Elizabeth allotted me, so I'm sorry. Does anybody have questions? The ideas to share was really for other librarians when they did this presentation another time.
Yeah, well, thank you though, Jill. It sounds like it was a good program. And one of the points was, it takes a while word of mouth between the inmates to get it rolling. And then just the continued cooperation of the detention center as well. So, it sounds like it's tricky to implement and maintain, but I hope that we can get that going again, because in a lot of aspects of that would address, some of the issues that we see with the ACEs, that go along with imprisonment. So thank you for sharing that with us.
Yeah, we do hope to get it going and also to expand it to the new community correction center as well. But
Good. And maybe, I don't know, maybe I don't know if you guys have talked about the mobile library being a part of that as well. I don't know. We are getting a mobile library next year, so we'll have a truck that goes around the community. We'll have mobile librarians and do an outreach. So hopefully, maybe
Yes,
can
they
do a
will.
part
They
of
will
that too.
hopefully be involved as well. Stephanie
Yeah.
says in the chat, we also worked in the detention center, saw many of the issues you were experiencing. We haven't been able to return either. Yeah, they're being very cautious about bringing back programs with people from outside of the staff coming into the detention center. Even though here on the outside, we're mostly acting like the pandemic is winding down, you know, in places like a detention center, if the COVID germs get in, they can really run rampant because they're closed environments and tight spaces. So they have to be cautious.
So I'm going to share just a couple of resources that I came across in just doing my research. And some of this is the Rutgers University National Resource Center. They have a lot of good information on that site. For anyone who knows of a family who has a parent who is incarcerated or who has been arrested, there is I can't remember what NICIC stands for. Does anybody know? Stephanie, anybody? But that's how to explain a parent's arrest to a child. I can put that link in the chat. I have to send it out to you guys. So I can send these to you as well. But the Little Children Big Challenges is also working with children and families, ages 3 to 8, who have an incarcerated parent, and it is a bilingual toolkit. I want to thank Rebecca and Jill and Stephanie for being here and talking to us and taking their evening to do this. It's a really important topic that affects all of us because these children, they grow up and they become adults in our community. And we want healthy, happy, functional members of society to live in our community and live and work with us. So it's really important that we take care of each other. So, and thank you to those of you who did attend and take the time to listen, because I know this was a little bit of a longer program than some of our others. So I appreciate that as well.